Hello everyone, welcome back. My name is Dr. Vijay Bhatia. Today I'm going to talk about disorders of adult personality and behavior. This includes a variety of conditions and behavior patterns, and they have clinical significance, which tend to be the expression of the individual's characteristic lifestyle and mode of relating to himself or and others. Some of these conditions and patterns of behavior emerge early in the course of individual development as a result of both constitutional factors and social experience, while others are acquired later in life. So what we are talking here is that there are patterns of behavior. They have been present from quite early in their life, from whatever they have learned in that culture, in that society. But here, what happens is they become clinical significance because they don't fit into that culture. They are very much individuals, that person's own lifestyle, the way the person relates with himself, the way the person perceives himself or herself, and the way they perceive and relate with the others is different, is not in their culture, is very different. And these emerge early in life, and it sounds that they are constitutional, that they are made like that their genes, their structure, their functioning, the enzymes in the body, their whole system, the constitution of the person, it seems that they are developed like that. And however, they social experience, their own personal experience has affected the way they have become. And in other cases, it seems that they have acquired later in life, but still we are talking about late teenage years or early adult life. Now, specific personality disorders or mixed and other personality disorders and enduring personality change. We are talking about these because they are deeply ingrained and enduring behavior patterns. So deeply ingrained, they are part of you, and they are enduring because they will be present in every situation, every place, every environment, every time. So it's like three-dimensional, with the time, with the place, with other people. So you are displaying the similar pattern of behavior, and they are inflexible. Even if somebody is telling you not to behave in that way in that situation, they doesn't learn from that. They are inflexible because that is the way they are, manifesting as inflexible responses to a broad range of personal and social situations. They represent extreme or significant deviation. That's where the disorder comes, because they deviate significantly or extremely from the way in which the average individual in that given culture would have perceived to behave and act and think. But this person who suffers with personality disorder behaves, thinks, and feels differently to the others. That person does not relate with the other people in the same society, in the same culture. Their way of thinking, their way of feeling is very different from ordinary person in that culture. That's where the disorder comes. So the person will be brought by that family or loved ones that this person is acting and behaving very differently from other people in the same society, in the same area. Therefore, something must be wrong with them, and they try to seek help from local healers, from religious people, or from medical doctors and mental health help. Such behavior patterns tend to be stable. So when we say stable again, it is to do with time. So it is present now at age 7, they are present again at 10, so they are stable and encompass multiple domains of behavior. So it's not only one domain of behavior that person is playing oddly, person is hitting others, person is enjoying fire, person is enjoying killing animals. That is normally not in that culture. They are loving people in that culture, but this person is so different. He hates animals, he kills them. So this person is so different. That's why the society, the person is in called disorder. And even with their psychological functioning, the way they even feel, they become scared of little things that they shouldn't be. And in that society, in that culture, person is supposed to be adaptable to those circumstances, but this person isn't. They are frequently, but not always, associated with various degree of subjective distress. So that is another point in the disorders of adult personality, that either the person or the other people surrounding him, it causes a significant distress. Either the person is distressed by these behaviors, these interactions, or the other people are getting into problems because of that person's behavior who suffers with personality disorder. Now, there are some diagnostic notes on this point. Now, the important things to differentiate to understand is that personality change. We are not talking about the personality change here. We are talking about the personality disorder. So personality disorder differ from personality change in their timing and the mode of the emergence. They are developmental conditions. So personality disorder is a developmental disorder. As we said, it is their constitutional factor, as if it is part of them, which appear in late childhood or adolescence and continue into adult life. They are not secondary to another mental disorder or brain disease, although they may precede and coexist with other disorders. In contrast, when we talk about personality change, this is acquired. This person was behaving fine within that culture, within that family, within that society. There wasn't any problem. But then change happens. And during this change, it is a very stressful, prolonged period, or they are put in some kind of foster care or orphanage where there is um, lack of care, lack of understanding. There are problems in the psychological development of the person. So there has been a significant change in the person's social circumstances and affecting the psychological development. That causes the change. And that will be personality change because of this prolonged stress or extreme environmental deprivation, or there might be a serious psychiatric disorder, or brain injury or a disease that might have altered the person's perception, feelings, thinkings relating to others. So personality change is very different from personality disorder, which we believe is the constitutional developmental part of the person and represents in his lifestyle or her lifestyle the way they are. However, they are different from the norms of that culture. Therefore, they qualify for the diagnosis for the personality disorder or personality change depending on the timing and the other mental disorders in their life. Thank you for listening this video. If you like this video, please press the like button, share with your friends and subscribe the channel.